Bismillahirrahmanirrahim. Assalamu alaikum, dear students. Today I want to teach you the anatomy of anterior abdominal wall and the formation of rectus sheath. Before we proceed to the actual topic, I want to tell you what is the arcuate line, because to understand the anatomy of anterior abdominal wall, it is must that you should be knowing that what is the arcuate line. Arcuate line, this is the arcuate line. It is also known as semi-lunar line of Douglas. It is a line midway between the umbilicus and symphysis pubis. Roughly, it is a curving line, roughly at the level of anterior superior iliac spine. This is a curving line between anterior superior iliac spine, but it is very important that its position may vary person to person. Now I want to show you how the arcuate line looks on the body. Here you can see it is bilateral. On this side also, here you can see this is the arcuate line. And below this, the posterior rectus sheath is absent, and the rectus muscle lies directly on the fascia transversalis. In other words, arcuate line is a demarcation point where the posterior rail of rectus sheath is absent or it ends. And below this point, the posterior wall of rectus sheath is absent, and rectus muscle, this muscle lies directly on the fascia transversalis. Now I want to explain how the rectus sheath is formed. This is the section above the arcuate line. You can see this is the skin, then is the subcutaneous tissue. This is the aponeurosis of external oblique muscle, and then is the aponeurosis of internal oblique muscle. Internal oblique muscle aponeurosis splits into anterior layer and a posterior layer. Now the anterior layer of internal oblique muscle along with the external aponeurosis of external oblique muscle forms the anterior layer of rectus sheath. And the posterior layer of internal oblique muscle along with the aponeurosis of transversus abdominis muscle forms the posterior layer of rectus sheath. This is the rectus abdominis muscle on both sides. This is an important content of rectus sheath. Then is the fascia transversalis. You can see the fascia transversalis, fascia transversalis. Then is the extraperitoneal fat or preperitoneal fat, then is the peritoneum. In this way, you can also understand the layers of abdominal wall, that how the abdominal wall is formed. And internally, if you see, this is the falciform ligament. Anterior and posterior layers of rectus sheath unite in the midline, forming a fibrous tissue structure which is comparatively avascular. This is called linea alba. This is very important. Usually, when we do laparotomy, we made incision in the midline and we divide the skin subcutaneous tissue, then the linea alba, because it is a bit avascular, so less bleeding occurs. Now, this section is showing the formation of abdominal wall or formation of rectus sheath or anatomy of abdominal wall muscles. Here below the arcuate line, the anatomy is a bit different. Here you can see what happens. Again, this is the skin, then is the subcutaneous tissue. Here the subcutaneous tissue has two layers. One is the fatty layer, which is also called as fascia of Kemper's. Second is the membranous layer, which is called Scarpa's fascia. Now it is very important to understand that at the level of arcuate line, the internal oblique muscle aponeurosis does not split. And all three muscles aponeurosis, external oblique, internal oblique, and transversus abdominis muscles pass in front of the rectus abdominis muscle, forming the anterior layer of the rectus sheath, and below the arcuate line, the posterior rectus sheath is absent. And here the rectus abdominal muscle directly lies on the fascia transversalis. And other structures are same. This is the extraperitoneal fat, and this is the peritoneum. And on umbilical level, or below the arcuate line level, how things look from inner side. This is the medial umbilical ligament or fold, and this is the remnant of obliterated left umbilical artery. This is again medial umbilical fold, a remnant of right umbilical artery, and this midline fold is the median umbilical ligament or median umbilical fold. This shows the obliterated urachus. Now, I hope I satisfied you people. Now, it will be very easy for you to understand the different layers of abdominal wall, formation of rectus sheath, and formation of rectus sheath or anatomy of anterior abdominal wall muscles, how it is different above the arcuate line and below the arcuate line. Thank you very much. I hope I satisfied you people. Again, if you have any difficulty or if you have any query, you can ask me through your comments. Inshallah, I will try to reply you and satisfy you, because your satisfaction is my priority. Thank you very much. It is important for surgeons also that they should be knowing the anatomy of anterior abdominal wall. Now I want to tell you a few important exam questions and Viva questions. You may be asked, what is the arcuate line? What are the layers of anterior abdominal wall? How rectus sheath is formed? Difference in the anatomy of anterior abdominal wall above and below the arcuate line, and what is medial umbilical ligament, and what is the median umbilical ligament.